Okay, this is Mr. Okidi Henry. He's the lab manager of the regional referral in Mbale district, which serves a wide area. This area is close to Kenya, the border with Kenya, and he's going to tell us a little bit more about his work with East African Public Health Lab Network in his hospital and laboratory.
This project, Mbale Regional Referral Hospital, is one of the sites which was chosen by the project. And the major activities at the site included the management of disease surveillance, especially cholera, training in capacity building, laboratory quality management system towards implementation, monitoring and evaluation of progress, ICT, networking, and support supervision, which we have been doing in the eastern part of the country. Now, major achievements in the project implementation at this facility included the hospital has identified a laboratory construction site for the new laboratory. We have also trained the resident mentors which have been doing the mentorship within the facility, and we have conducted support supervision done in the peripheral labs. We have also facilitated the training of laboratory personnel in biosafety and biorisk management. There is the procurement of the incinerator which has been done. It is awaiting installation. We have also trained peripheral lab personnel in placement referral, especially for disease outbreaks. And we have procured the gene expert equipment, which is now for the management of multi-drug resistant TB at the facility, and is working well. Mbale Hospital has participated in the regional peer assessment by trained assessors from the project. They also provided funding for the laboratory management, and this has helped us to generate the standard operating procedures and other facilitation for the staff. Now, the major key lessons we have learned through the project is how to generate work plan activities within a budget and the time frames. We have also developed the quality and biosafety manuals, and we also managed to write the clinician's handbook. We have learned how to carry out internal audit recommendations, and the action plan and follow-ups of the audit result of the audit. We have also learned how to do corrective actions on non-conformities. The major challenges we have in the facility is one, the understaffing of staff, which makes it difficult for the action plans to be identified. There's documentation and quality improvement projects which are still wanting. No service contracts for equipment maintenance from the Ministry of Health. Most of the equipment tend to break down, but then there's no service contract from the facility. And there's no system in place for calibration of some of the equipment, for example, pipettes. Now, what could be the way forward? The way forward, one of them could be the identification of action points or plans from the gaps identified during the peer assessment. This was December 2012 and November 2013. The involvement of the administration and all the laboratory staff in quality improvement projects. Then monitoring and evaluation of progress according to time frames. Then that can be also the carry out internal audit activities for the quality improvements. This one covers some of the things we had done at the East African project in Mbale Regional Referral Hospital.
Okay. So in relation to some of the things like data management and equipment, what would you say about that?
The project has also given us the facilitation to recruit a data clerk who will be managing the data system. And also procured some equipment like the computers, the modems, and the laptops for the facility. All these are under the project, and the facility has benefited from that.